Hi friends, welcome to classes by Lab Doctor. I'm Dr. Divya and in today's class let us study about the WBC casts in the urine. You all know that these urinary casts are formed only in the distal convoluted tubule or the collecting duct or the distal nephron. So the proximal convoluted tubule and the loop of Henle, they do not form any kind of a cast, and mainly these casts are formed by the protein, that is the TAM phosphol protein. So there are different types of casts. We categorize them into acellular as well as cellular. The acellular, the casts which have no cells, are hyaline casts, granular casts, waxy casts and fatty casts. And the cellular casts are the ones which contain cells in them. They could be RBCs, they could be WBCs, they could be epithelial cells, or they could be mixed cellular casts. So this white blood cell cast, they signify, white blood cell anywhere signifies that there is an infection, there is an inflammation. So similarly, when you find the WBC cast in the urine, it signifies that there is an inflammation or infection in the nephrons, and it mainly suggests that there could be a possibility of pyelonephritis. So observation of free WBCs along with WBC cast mostly indicates a infection or inflammation in the kidney. So this, you should, I have told you that this cast mainly signify infection or inflammation within the nephron. So frequently they are associated with pyelonephritis, and here you can see a WBC cast. So the acute pyelonephritis or pyelonephritis as such is the most common cause of these WBC cast in the urine. So you can see here the inflammatory cells which are packed with inflammatory cells. So what is acute pyelonephritis? It is nothing but nephritis. Itis is inflammation. So whenever there is inflammation or infection of the kidney, so there could be a bacterial infection of the upper urinary tract, which usually develops from the lower urinary tract infection. So that is called as pyelonephritis. The patient presents with fever, flank pain, etc. So in these conditions, what happens, you can see here, this is a case of pyelonephritic kidney. You can see that the right kidney, when we have cut open here, you can see the pus cells here. Because of the inflammation, there is scarring of the tissue. You can see the infection here. So all this will cause painful voiding. There is low back pain. The patient has fever, and also his urine examination might show you WBCs as well as the WBC casts. So where do we see this WBC cast in the urine? Whenever there is infection or inflammation of the kidney. That can happen in case of pyelonephritis, or in case of interstitial nephritis, in case of glomerulonephritis. Glomerulonephritis, you also get RBCs, you also might get dysmorphic RBCs or RBC casts, etc. Whenever there is a renal infarction, if there is a lupus nephritis, there is a possibility that you will get a WBC cast. So remember, whenever you see these casts are mostly composed of neutrophils. So that is a prominent WBC, and that is why these casts appear very granular. So this WBC cast matrix is made up of, again, of protein, and it contains mostly the neutrophils, giving it a very granular appearance. How do we report it? We report it as number of WBC casts per low power field. You will have to correlate it with the protein in the urine. You should also correlate with the leukocyte esterase, etc., to come to a conclusion. Sometimes supravital stain can also be used to demonstrate the nuclei of the WBC. So it is helpful when we want to differentiate whether these cells could be WBC or these cells could be renal tubular epithelial cells. So always correlate with the WBCs in the urine sediment along with the protein in the urine as well as the leukocyte esterase strip. So also correlate with the bacteria, and also see if there are eosinophil casts which you can see in acute interstitial nephritis. So there is a requirement for correlation rather than blindly following on the cast. So you need to correlate everything. You need to correlate the free WBCs, what you can see. You need to correlate the RBCs. You need to see the proteins, etc. when you want to give a or come to a conclusion of pyelonephritis or any other pathology. So this I've told you that this mainly contains the neutrophils. That is why you will usually see that these casts are granular. So you can see the multilobated nuclei also which are present. So also when you see free WBCs in the sediment, that points more towards your diagnosis. So bacteria also can be present in case of pyelonephritis, but I've told you that they are also, the WBC casts are also seen in case of acute interstitial nephritis, whereas you will not see much of this bacteria, and mostly you can also see eosinophils in acute interstitial nephritis, and in pyelonephritis you see WBCs, free WBCs, WBC casts, as well as the bacteria. So this is a picture of a WBC cast. You can see the WBC which are granular here, and this is a clump of WBCs. You cannot find the cast matrix here, and see here again you can see the WBC. You can even see the granular nature of the cytoplasm as well as the multilobated nuclei here, and here these are the various other pictures also. So because mainly it is a neutrophil which is the predominant cell of this cast, it gives you a granular appearance. So remember, WBC cast, it signifies inflammation or infection within the nephron, and most common cause for this is pyelonephritis, or it could be because of acute interstitial nephritis, glomerulonephritis, or autoimmune disease like SLE, etc. So you need to correlate with the urinary other urinary finding, like it could be the urine WBCs, free WBCs, what you can see, the urine leukocyte esterase, the urine bacteria, the urine protein, the urine RBCs, etc. when you want to come to a conclusion. So that is all about WBC casts in the urine. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.